All right, we continue onwards with lipids, vitamins. All right, so you should be knowledgeable now on your lipid categories, fats and oils, steroids, a very, very different type of lipid category, important biologically. We get now into a small category, but important category that we call lipid-soluble vitamins. So lipids having a role as a vitamin. And we're going to contrast lipid soluble with water soluble, right? So if you know something about solubility, soluble means to dissolve in. So there are these four types of lipid vitamins. Then they're lipid-based. Since they're lipid-based, they dissolve in lipids. So they're lipid-soluble vitamins because they are lipid-based. So they're going to be vitamins A, D, E, and K, right? Vitamin A is going to be an important vitamin for our different types of photoreceptors in our eyes. We have cones, we have rods. Cones are for color vision. Rods are for light sensitivity vision. And these vitamin A molecules are going to be part of the photoreceptors, that light sensitivity. Vitamin D is for absorption of calcium, and this is a big deal, right? In Anatomy 1, Anatomy 2 as well, but in anatomy class, you're going to learn a lot about calcium's role in muscle physiology, in action potential, nerve impulse generation. So you cannot have a muscle contract. You cannot have muscles generate strength. You cannot have the heart undergo contraction, systole, without having calcium. So calcium is very critical. But we cannot absorb calcium into our body without vitamin D. So vitamin D is like a key that opens a channel to allow calcium in. So very critical. Kind of like we talk a little bit about diabetes. We have insulin that's the key that allows glucose in. Very, very analogous. We have vitamin D that's the key to allow calcium into the body. So you can have all the calcium in the world, but if you don't have vitamin D to let that calcium into the body, that calcium is not serving its purpose. So very, very critical, vitamin D. Vitamin D we can get from our diet, but vitamin D we get from sunlight. If you go outside, that solar radiation, that UV radiation is hitting our skin, there's a chemical reaction that generates vitamin D for us. So if you live in El Paso, also known as the Sun City, we get over 300 sunny days a year. There's no reason that you should be deficient in vitamin D. But a lot of people in El Paso are deficient in vitamin D because they don't go outside, right? It's a very simple solution. Just go outside. If you're these vampire people that don't go outside in daylight hours, or go outside all covered in long sleeve, that kind of stuff, then you're not getting adequate amounts of vitamin D. You will then need to supplement. Take your SpongeBob vitamins, supplement with these vitamin Ds. Vitamin E is going to be an antioxidant, important for the skin, for membranes. We talk about oxidation. Well, this is antioxidation, an antioxidant. So it helps keep tissue, helps keep these bonds stable, these molecules stable, these elements stable, and not allowing them to decompose, break down, that kind of stuff. So antioxidant. If you have any types of creams or lotions, most of those that you put on the skin are going to be infused with vitamin E, right? And the body can absorb it through the skin like that. Then vitamin K for normal blood clotting, right? K for clotting. Right? This should be in the notes, just showing you the vitamin, maybe sources of where we get that vitamin naturally, the functions. The key point that I want to address here is the idea of these two columns here. So fat-soluble vitamins. We can end up in situations where our body becomes deficient in fat-soluble vitamins, but we can also get into situations where our body is in excess amounts of fat-soluble vitamins. So fat-soluble vitamins have to be maintained in a sort of a medium, midline homeostatic point. Problems happen when we're deficient. Problems happen when we're excess, overdosed, right? So effects of deficiency, some of these, we'll go through these quickly, but scaly skin, skin sores, blindness, not good. Bone deformities, not good. Gastrointestinal problems, chorro, not good. Neural tube defects, birth defects, not good. Bleeding, not good. So all of these are bad things that happen when we don't have enough of the fat-soluble vitamins. We have too much, headache, hair loss, kidney damage, blurred vision, liver damage, anemia, bad things as well, right? So again, the moral of the story, we have to have A, D, E, and K in our system in moderate amounts, right? Deficiencies can be bad, excessive overdoses can be bad. So an important distinction. Now, there are other vitamins besides these, but those other vitamins are not fat-soluble vitamins. They're going to be considered water-soluble vitamins. I think most of you know about vitamin C, the B complex, thiamine, riboflavin, the B12, B6, the folic acid, biotin. All of these are water-soluble vitamins. So when we consume these, they're not stored in our fat like fat-soluble. Right? These will be stored in our fat cells, and we metabolize that fat cell. It releases then these stored vitamins. Water-soluble vitamins dissolve in body water. So body water may be inside of a cell, body water, blood plasma, but not in the fats. So again, showing you the vitamins, showing you the sources, the functions. But I want you to notice here, right? Can we run into situations where we don't have enough water-soluble vitamins? Yes, we can. Right? We have these deficiencies, water retention, that's bad, heart failure, skin lesions, neural tube defects, muscular disorders, sore tongue, kind of weird, I guess, but scurvy, all of these factors happening when we are deficient. Now, if you notice, there's an important column missing. It's not there. Can we run into situations where there's an overdose of water-soluble vitamins? No, not really. Since these vitamins are stored in body water, if you, let's say you eat 20 oranges right now, right? You go eat a bunch of strawberries right now. You supplement with vitamin C right now. Well, the body's gonna extract what it can use. Whatever's in excess amounts, the body just kind of leaves into the kidneys, and then the kidneys will urinate out the excess amount. So these are not stored in the body. So we don't have a risk of excessive amounts, but there's a big risk of being deficient. Because if you're not supplementing yourself with water-soluble vitamins each day, you're not going to have those available. So I don't know if any of you analyze when you go to the bathroom, to say when you're urinating. Like for guys, I guess it's kind of easy. You just kind of like glance down and you can see the color of the urine. Ladies, I don't know, maybe you lift the leg. I don't know, maybe you can do something like that. But you can analyze the color of the stream. And if it looks like water is leaving your body, then you're well hydrated and you're not excreting excessive amounts of water-soluble vitamins. If you look down and it looks like Gatorade leaving your body, right? Like very dark, very just full of solutes, that kind of stuff. Well, one, maybe you're dehydrated, or two, you're consuming a lot of these water-soluble vitamins and your body has extracted what it has, what it needs, and then it's excreting all the rest. So if you ever go to a gym is about business. A gym is about money, right? And they're going to want to sell you all these extra supplements. Oh, you need this, you need this, you need this. Honestly, you probably don't need all of that. You're trying to make bucks by selling you all that stuff. But simple analysis. If you're urinating very, very dark colored urine, you're probably over supplementing and you're probably under hydrated as well, right? So an important distinction there between water and fat-soluble vitamins. So just for your information, right, FYI, fat-soluble, anything that's fat dissolves in non-polarity. Anything that's water-soluble will dissolve in polarity. Water is polar, fats are non-polar. So that's that important distinction. We mix fat and water, oil and water, we shake, we mix, we stir, and that oil will always separate out. They don't dissolve in water. So those are the vitamins. Real quickly here, also another category of lipids are waxes. Waxes are very highly nonpolar. Their role is to waterproof certain areas, right? Naturally, we can find these in birds and in plants, certain cactuses, certain tropical plants do this. The waxes are designed to repel water, to prevent water loss, to trap water in, and that water that's in there can't cross that nonpolar barrier. We can have waxes in our skin, in our hair, plant leaves. If you analyze children or yourself, you know that our body produces wax in our ears, right? This is of biological significance. Right? That little ear canal is like a perfect little cave for bacteria, for fungus to live in there. So if water were to be trapped in there, it would stay moist, humid, good environment for these types of infections. Well, the body doesn't want that, so it produces earwax, which is very strongly non-polar, very highly non-polar. So it sort of repels water from accumulating in the inner ear, making it very difficult for humidity to establish there. Also, it's sticky, so any bacteria that is in there gets stuck with the earwax, and if it's cleaned out on a regular basis, we get rid of that. It's very acidic as well, so it makes it difficult for bacteria to thrive in there. So it's an important, maybe not a nice thing, but it's an important physiological defense mechanism, part of our innate immune system, earwax. This next bit, phospholipids, I'm gonna connect these with the diffusion lecture, right? So I will wait on these. I don't want to lecture it and then just re-lecture in the next section. So these for sure will be up next time. But for now, that's a good stopping point for our vitamins and waxes. So with that, you'll have a great one, and I'll see you all next time.